All right, let's go ahead and get started. So, welcome everybody to GIS Day 2025. My name is Frank Curriero. I am the director of the Johns Hopkins Spatial Science for Public Health Center, and I'm going to kick us off today. Of course, going to introduce our speaker, and then I'll follow up with a talk myself just about some of the spatial analysis stuff we've been doing here at the school over the last few years. And then this session goes until 3 o'clock, and then we have two remote sessions to follow up with GIS Day that is being done by data services over at the Homewood Library. So I am pleased to introduce our speaker, Dr. Dick Sadler. He is an NIH-funded medical geographer with expertise in environmental science, GIS, food system planning, and land use policy in legacy cities. He earned his PhD in geography from the University of Western Ontario in 2013 and his MPH from Johns Hopkins in 2020. So, yeah, well, welcome back. Dr. Sadler's research integrates urban planning and public health topics related to neighborhood effects on health. Recently, this has revolved around linking urban development practices, including, but going beyond redlining, that exacerbate racial and socioeconomic inequalities. Dr. Sadler combines spatial analysis, which is great, and community-based participatory research approaches. The overarching goal of his work is to strengthen the understanding between the built environment and health behaviors and outcomes with the goal of shaping land use policy to build healthier cities. Perfect for what we want to hear about today. So you're going to talk to us about, not just redlining, an urban geographer's view on neighborhood change influencing health disparities. So welcome again. Thank you, Dr. Sadler.
I'll set myself to a timer as well. 20 minutes.
Long as you need.
So, all right. So thank you for indulging this semi out of the blue offer. So I work with Michael Desjardins indirectly on health and medical geography specialty group governance within the AAG. We actually haven't published together yet, but I'm hoping to change that in the next few years. I also, I did my MPH here. And so my academic mentor of many years was Deborah Holden, who had previously been a faculty member in mental health here at Hopkins, had created the nifty tool for Baltimore that we brought to Flint. And so some of my work kind of straddled Flint and Baltimore and related cities that have undergone periods of decline and disinvestment. And so this work started in Flint, shifted to here. It's expanded into Pittsburgh and some other places in Metro DC. But the focus, mostly the focus today will be on the work we do in Baltimore. So a couple of ways to directly link to GIS Day and GIS, so you can see the kind of broader spread. I'm not going to go super in depth into any one piece, but our general idea in this grant, it's an NIA R01, is to look at cumulative built environment exposures over time and link them to a longitudinal cohort study, leveraging residential histories that we will obtain from these individuals. And so it includes some archival data generation. We have folks in the Baltimore City Archives. I've been into the University of Baltimore Archives, and I was at the City Library on Monday. So we get to do some of those fun base level tools, georectifying, digitizing. Our spatial statistical approach is still partly to be determined, but again, we're trying to figure out, how do these clusters roll together spatially? How are they correlated to one another, and how do they evolve over time? So especially as we start getting into that longitudinal piece. That is not something that's my expertise, but I fortunately have really great colleagues that I'm going to bat those ideas back and forth with. And ultimately, a lot of the work I do, as Frank mentioned, is that it's very partner-informed, community partner, organizational partner. And so I would like for this to have relevance to the Baltimore community and for individuals in various parts of the community to be able to make use of it if it's of use. Also wanted to illustrate a couple of fun methodological routes that you may be familiar with. One, hopefully everybody is at least vaguely familiar with the modifiable areal unit problem. I often will give related talks or talks on some of this stuff to undergrad classes. So it's always fun to okay, which of you have been paying attention in class? This was the thing that was of importance to the Flint water crisis. When I had done some work with that, the state had been trying to discredit our colleague Mona Hanna because of the way that they were measuring their exposure framework or exposure frame. So they're defining Flint inappropriately by its zip codes and not by its city boundary. And then I also like referring to this term called, and I'm blanking on the author, but maybe 12 years ago or so, someone wrote on spatial polygamy, which I like. The term doesn't get used a lot, but I kind of think it's a fun, silly term for thinking about the way that exposures aren't just limited to the home. That's all that it's based on. But so some of the ways that I'm thinking about these issues, along with this kind of urban planning, urban historical view, are rooted in that. So yeah, so fundamentally, the way we're thinking about our work is that cities like Flint, like Baltimore, we've lost population, our tax bases have declined, our infrastructures have declined, and so environmental injustices wind up getting heaped over and over on lower income and often minoritized populations. And then we have, these interrelated issues with the physical environment. And so one of the premises being that this weathering effect of living in such neighborhoods can in this particular project's example, create premature aging. And of course, we know that these processes are systematic in many ways, and they're not simply byproducts of economic change, but they're political decisions. And so we talk about structural racism in the built environment. I play with different phrasing because I realize in this particular point in time and cultural milieu that some of these words are scary to some people. So sometimes I just call them urban development practices because fundamentally that's what they are. It just happens that urban development practices in the past have often been racist or classist or both. But the basic premise being that the housing decisions that we made over many decades at many different points of time impact neighborhood trajectory and not just by redlining. So the way I got into this was, I grew up in the Flint community. I had gone to grad school in Canada, but I'd been working for Flint's, interning at their land bank, which manages vacant property, and then with the city and the health department, just kind of like little short-term internships. But I was getting my hands on some data and starting to explore the ways that historians talked about Flint's decline. And when I saw which neighborhoods in Flint had been historically segregated, the predominantly Black neighborhoods are outlined here in red, although in fact, and there's a bad symbology decision on my part here, so I'll critique myself. Flint's red-lined areas don't just include those red outlines on this map. They also included a lot of poor white neighborhoods, but the key element here is that 100% of Flint's Black neighborhoods were redlined. But what we showed in this paper was that the neighborhoods that had experienced the worst decline in housing condition from 1960 to the 2012, I think, housing environment study that Flint had done were not neighborhoods that had been redlined, but neighborhoods where white flight had been most extreme in the 1960s and 1970s. Right, I can point. These neighborhoods, the neighborhoods in the middle and then farther off to the northwest. So it wasn't economic change, the age of neighborhood or other factors. It was the fact that what the white population had departed these neighborhoods and started creating vacancy crises before there was ever any economic change. So then subsequently, we also did some other studies in Flint, suburban DC, Pittsburgh, and then also a couple studies here. We're using that basic premise that it's not just redlining. And this was before the mapping inequality study came around. The University of Richmond published redlining maps for the whole country. All this work predated that, or at least its popularity. I was just using redlining maps from because they had been online just in different places. But so we also started looking at patterns of white flight in these other cities, and we kept finding that areas where at least half the white population left within one decennial census period, which is what we call blockbusting or probable blockbusting, they correlated to a whole host of outcomes: neighborhood decline, poorer mental health, for boys, gentrification influenced girls in that one particular study. Both blockbusting and patterns of urban renewal in Pittsburgh correlated to poorer outcomes in Pittsburgh, worse than redlining. So all these are kind of benchmarked versus redlining. So something else is going on, right? And so part of the idea of this grant that I'm working on with my colleague Danielle Beatty-Moody at Rutgers is to dig around and find these culprits and then link them to an aging cohort study that she has worked with for, I think, about 15 years here in Baltimore. So some of the types, I'm going to run through these, but this is just to illustrate, right? Like redlining's in the mix. It's important. It generated patterns of disinvestment in cities, but so did white flight and blockbusting. Gentrification has the opposite effect, right, of population displacement. Restrictive covenants arguably buffered neighborhoods from experiencing many of these things. And we still have ongoing patterns of racial steering and segregation. So Restrictive covenants have become a more popular thing to study by like urban historical geographers. It typically requires either getting individual deed descriptions or historical neighborhood, like descriptions of neighborhoods when they were built. And I'm going to try to stave off the sneeze here. So, right, so this is for Ann Arbor. I have colleagues that have done this for Tucson, Omaha, areas around Minneapolis. And the intention here is to see kind of opposite redlining. Where were there neighborhoods that were very exclusionary and specifically would not, banded together, white neighborhoods that would band together and say, look, we're not going to sell any of these homes to anybody who's not white. That's what the essence of restrictive covenants. This became illegal in 1968, but there's some thought that this has had a buffering effect in the favor of neighborhoods that has historically experienced it, because they also used these to exclude multifamily homes, public housing complexes, so on and so forth. But so these aren't typically digitized. This is something that we're doing some archival digging for, both online and at the city archives. Redlining, it's already been digitized. There's a lot of work on it. It's of interest to a lot of people. But again, like we're arguing like, okay, cool, this is important. Let's keep moving beyond this. Let's include this as a variable, but see how it relates to these other things. This is the redlining map for Flint. So you can see one more time, like the middle section of the city of Flint was where the predominantly Black neighborhoods were, but you also see areas around that were redlined that were predominantly white. So that's another kind of piece I make sure to discuss, is when folks want to incorporate redlining, sometimes they're saying redlined neighborhoods were where all of the predominantly minoritized populations lived. Well, sorry, that sentence is true, but not every redlined neighborhood had a non-white population. And in fact, a lot of historically redlined neighborhoods eventually had new forms of housing investment put into them and would have functionally moved out of that classification. So it's important to see like the bigger picture here. So where cities decided to build freeways has a very classist and racist tinge to it. So understanding if someone, for example, lived where a freeway was built or proposed. So there was a freeway proposal. Emily Lieb just came out with a new book, Highways to Nowhere, I think is the title, exploring the freeway that was never built down to US 40, I think, the highway to nowhere, and then like through Edmondson Village neighborhood. Part of that, those homes were condemned, but they were never demoed because then the freeway failed. But the houses were still condemned, so people still experienced a loss from the planning of freeways that in some cases weren't even built. So it's a bit of historical digging required for this. And it helps that folks like Emily have written books on these, so we can reference these books and start understanding what kinds of neighborhoods we need to be picking out. I mentioned this pattern of white flight and blockbusting. This is just another view from our paper. And so just to reiterate, the neighborhoods that had declined the most in Flint weren't redlined neighborhoods, they were blockbusted neighborhoods. And that was based on the condition of housing in 2012 as compared to 1960. And so I call this a self-fulfilling prophecy of decline, because white residents would flee neighborhoods that were perfectly fine because they often didn't want to live in racially integrated neighborhoods. Real estate agents would stir up fears of losing housing value, or what happens when a neighborhood changes away from being predominantly white. And so they'd flee these neighborhoods, and then housing decline would set in, because in Flint's case, at least in particular, there was never as much of a population moving into neighborhoods permanently as we're moving out. So it creates this neighborhood life cycle of decline where neighborhoods wind up with higher and higher vacancy rates over time, because they're like the slightly less desirable communities. Basically, we just built way too much housing and left the older housing to rot. We have pattern things like gentrification that are pretty well studied. But again, I think that there's been a gap when people will study gentrification and redlining. They don't necessarily talk clearly about, these are places that had both. And so if we talk about redline neighborhoods, but we forget to include the fact that, well, these neighborhoods have also changed immensely with a ton of new investment in the last 30, 20 years. Think like areas around kind of the edge of Fells Point. Then we're missing part of the story here. Something that's also been of interest since the housing crisis is predatory lending. So we know from several examples that Wells Fargo had been outed on several occasions for targeting subprime loans to Black and other minoritized residents. And there's a spatial clustering effect to that, of course, because segregation is still a thing. And it hasn't been studied in relation to health very often. So thinking about how these foreclosures may have provoked increases in, or the subprime loans that eventually led to foreclosures because of inability to pay during the financial crisis could have contributed to vacancy or depressed home values and affected neighborhoods from a financial perspective in additional ways. There's one that's kind of interest, racial steering. I think this might be really hard to measure without some really in-depth community-based mapping exercises. So I have a colleague who had once moved to the South for a faculty position and was like, oh, I'd like to see some houses in this neighborhood. She's a white person. And the real estate agent was like, oh, well, maybe we'll show you houses over in this neighborhood. They literally steered her away from a neighborhood that was not predominantly white. And the inverse has been shown repeatedly to be true as well. But demonstrating that on a spatial level, I think would be really complicated in the absence of some kind of like huge community-based mapping effort where, like crowdsourced, where it's like, have you tried to rent places that you feel like you've been steered away from, or doing like the kinds of experiments that have been done in New York City where they'll send a white person and a black person on the same day to look at an apartment, and the black person will be told the apartment's not available or that the apartment's $500 a month more. There's ways that this steering continues. And I think it could be really interesting in this constellation of forces, but it would be very time consuming. And then, of course, like existing measures of racial segregation and exclusion, I think are valuable for understanding how neighborhoods are composed today. So I want to show you just a couple of visuals to compare redlining to blockbusting. So again, redlining, easy to use, public health people love incorporating it because it's the shape file is already there. But we're arguing that it doesn't account for these 60 plus years of urban change. And so the results wind up being mixed in some of these studies, I think, because of the fact that gentrification overlays some of these areas and the fact that patterns of white flight and blockbusting in other neighborhoods are driving higher disparities there. So by comparison, we've used National Historic GIS layers, just historical census data. We compare the white population in various decennial census periods, 1950, 60, 70, 80, 90, and then look at where neighborhoods have lost at least half or in some cases 3/4 of the population. So I think there's these interesting opportunities for studying this because formerly redlined neighborhoods do include parts of Fells Point that are, if they're not already gentrified or very redeveloped or in very good stable condition, are actively being redeveloped and gentrified. And so they're often inner urban areas. They have a lot of amenities. They have density of services that arguably a lot of blockbusted neighborhoods don't have. So this is out, I forget the exact neighborhood, the exact name of the neighborhood I pulled from this, but it's basically just northwest of the Mount Royal neighborhood, like Utah place, like maybe 2 miles farther down the road. This is a neighborhood that would have been predominantly white and had become predominantly black in the 70s. And blockbusted neighborhoods are more often suburban. They more often didn't have a lot of urban amenities to begin with. And then throw on top of it these vacancy crises and the lack of reinvestment in the last 30 or 40 years. And these are the places where you'll have big swaths of vacant land that really nothing's going on. So some measures I don't have both, but that's fine. So like I said, we've done some studies on redlining, blockbusting, and gentrification. We're digging into like where urban renewal would have occurred in the past. The dark blue on this map are the urban renewal areas. The big chunky blue are places with a high rate of public housing. The little dappled blue, like in the middle here, where Roland Park is, that's areas that we know had restrictive covenants. We're still uncovering more neighborhoods. So this is a very preliminary sort of map. But the proposed freeways are included in shaded gray. The skinnier gray are the actual freeways. So like the Jones Falls Expressway in the middle, but there were these other proposals for freeways literally all over the city, just this massive mess of additional freeways that fortunately, I think, I mean, I don't have to drive in Baltimore traffic every day, but we know the ills of freeways. And I think fortunately, a lot of these freeways weren't built, except for the fact that arguably during their planning, such as in the case of the Edmondson Village neighborhood, some of these places had been condemned, and so people lost value on their homes. So again, zooming out, the bigger idea here is when we start looking at all of these processes together, maybe it's not just redlining, but maybe it's growing up in one particular kind of neighborhood, spending your 20s and 30s in another kind of neighborhood, moving into somewhere else, and so on. So I have these couple examples. Imagine you grow up in a redline neighborhood toward the end of the redlining period. The post-war economy is suburbanizing. It's not benefiting interurban areas as well. And so your neighborhood doesn't really have much. I mean, there's a strong maybe social cohesion there. People have lived in the neighborhood for a long time, but there's other negative forces at play. Maybe you're exposed to more industrial pollution, and it looks something like this. And then you spend your young adulthood having moved out to a blockbuster neighborhood. So you buy your first house around the time that fair housing occurs, 1968. But your neighborhood starts immediately changing because of the financial disinvestment that occurred during that period. And so you live in the 70s and 80s in a neighborhood where vacancy rates may be increasing. You may have other social ills. And then you move out to an inner suburb by the 90s and the aughts. But then maybe that inner suburb starts going through these processes of economic decline, right? So this is an example where at each stage of your life course, you may have had more weathering to these different kinds of characteristics. Now take someone who's a little bit older and maybe lived in a redline neighborhood in an earlier period when there were more independent stores and community facilities. And yes, things were segregated and very unequal, but there might have been some buffering effects of, the kinds of effects that we sometimes see in like ethnic enclaves. And then say, maybe it looked something more like this and it was vibrant. And, and then maybe you move to an conventional inner suburban neighborhood kind of farther out. Looked like something like this, maybe a Wonder Years type childhood. Somehow you got around the discrimination that people would face at that time. And then maybe for your adulthood, you moved out to an outer suburb and maybe you drove a lot and, you didn't have an urban lifestyle, but there wasn't anything going on. There was nothing in the housing environment that was influencing you negatively. So at each stage here, you might have had less exposure. Right. And then last example, say you move back into a gentrifying neighborhood during your early retirement years. And so then you just get to walk around and go to the cute coffee shops and so forth. So those two people would have had very different exposures throughout their life course. So a couple of considerations we're wrestling with here. We're trying to think about how do we relate these exposures to each other and to different types? Like, are these binary exposures? Are they cumulative over month exposures? Because we're collecting residential histories, we are going to be able to account for these time varying and context-specific exposures. And so we're trying to come up with ways to think about the intensity and frequency or the duration at which people were exposed to all of these things. And zooming back out, one of my big goals is to try to create these layers from multiple cities, see how processes of urban decline or reinvestment influence different cities in different ways, because maybe in some places redlining does matter most. Maybe in other places, the story is about the patterns of urban renewal or restrictive covenants. So these are some of the projects that currently exist that are wrestling with some of these questions. I also always put a plug for, I have a colleague who's an urban historical geographer at Michigan Tech, and he's created basically a genealogical tool called the QAnon Time Traveler that includes 100% census data up through 1940, along with mining company records. And so they know exactly where people have lived, worked, gone to school, worshipped, died, like what they died from for like a 75-year period. And it's kind of a special case because it's in the Upper Peninsula of Michigan. It's very isolated. And the mining companies basically had data on almost everyone. And so when you combine it with census data, it creates this super, super rich data set. But the methods that they've explored have inspired me with this work. So I'm going to pause it there and thank you for your time.
Questions?
Yeah, I can see the chat.
Oh.
Posted there.
Oh, yeah. Cool.
Great. Any questions for our speaker?
Really like to ask Carnival mapping and some of the historical elements that it's when we just fresh off of this talk that we gave. That's what it's called. How privilege in public health governance. I got a chance to meet RST Brown.
Yeah.
Like what I was talking to him about the redlining maps and just some of the urban planning that happened. How you can have like maybe top of each other and see like things.
Yeah. Yeah, for sure. I'm gonna restate it for the folks online too. Just yeah. So no. Yeah. So the comment was on so having met Lawrence Brown, who wrote the Black Butterfly, and thinking critically about these like overlapping issues. And you said it was called Power, Privilege, and Public Health.
Yeah.
Was this event yesterday that you went to? Yeah. No, it's great. I think and yeah, my fellow MPI and I have met with Lawrence in the past, and I mean, this is kind of like a little bit of a road show. We want to make sure we're meeting people, getting to know people, and saying like, hey, we're working on this stuff, and especially when people are also in similar spaces. Like I know the Baltimore Ecosystem Study also, those folks look at redlining and patterns of like environmental health. And yeah, certainly like my colleague Michael Desjardins here, the work he does is very related. Yeah.
I think the questions you have listed up there are really interesting about
Oh, yeah.
space-time exposure,
Yeah, for
right?
sure.
It's not, it's likely not equally weighted across the lifetime,
Yeah.
and maybe earlier in life or later in life, things should get weighted more, and how to tease that out. I'm sure it all depends, on the outcomes you're looking at.
Yeah.
That can be a complex, a nice complex problem to
Yeah.
work on.
Absolutely. Yeah. And again, like I have, my level of training and familiarity with GIS, and I'm not a programming GIS. I don't use R, I don't use Python. I have an analyst that's a Python user, but some of it's beyond what I, have the wherewithal and the time to manage. So that's why for me, like having big, broad teams that can chew on these things, and I already have tenure. I don't need to publish anymore. I'm just kidding, it's great to be able to be a piece of the puzzle. I mean, I've always played team sports too. It's like I don't need to do everything. I just need to do my part. So
And that program, I mean, just not to get off topic, but that programming part, you said that's awfully time consuming.
yeah,
And as you move through your academic career up to full professor, you don't have the time anymore for that. You have the time to think about it.
Yeah.
I'd love to do this, and it's great to have that team surrounding you to actually do that.
Yeah. Like as a PhD student, I certainly had the luxury to dig in and read whatever I wanted to read, and if I wanted to try to learn a new skill set. I mean, it was very stressful. I think I'm less stressed now than I was when I was a PhD student, but I had that impetus to like, okay, I need to learn 17 new things so that I can become the expert at 3 of them or something. And right now it's like, okay, well, I'm kind of an expert at 2 of them, so I guess that's enough, and I'll just get to know other experts who are expert at other things. So yeah.
So is the hope for this, and maybe you're already there, to be able to kind of overlay exposure data from different, so like Aaron and I are both studying food systems here.
Cool.
So I'd be really interested to see, similar to how like we have Baltimore maps that overlay healthy foods priority areas, deserts,
Yeah.
with redline areas with potentially blockbusting, like the map that you showed overlaid that as well. Do you consider that as like, are you able to do that already, or is that?
Yeah, we could. And actually, I think I neglected to mention it, and I don't know why I forgot the line, but I have published a couple of papers. One was with Usama Bilal, who had been here. Some of you may know his name. And because he had written a really interesting blog post on redlining. I think it was on redlining and food access, but he didn't like do the study. So my capstone when I did my MPH, and I was a food systems track MPH student, I finished in 2020. And it was weird because I was already a faculty member, and I came back because my mentor, Deborah, was like, hey, go do your MPH. She's like, apply to Hopkins. If you get in, you have to do your MPH. And it's like, okay. So I did that while I was an assistant professor, balancing those responsibilities. But no, I mean, it was great. It all worked out really well. And yeah, so my capstone paper, we wound up publishing. Deborah Verholden and Usama and I are the 3 authors on it. I think if you Google our names and like food and Baltimore, We used Center for Livable Future data and consulted and worked with them and yeah, overlay. So we found that block-busted neighborhoods had poorer food access than redlined neighborhoods. And the gentrification piece explained a lot of it because like you've got Canton, Fells Point, places that maybe would have been redlined, but they have really rich local like food access scores.
Other questions or comments? Okay,
Thanks again. Yeah. Cheers.
Okay, I'll see if I can manage this without my glasses, but that may happen on pretty soon. So, like I said before, and if maybe people weren't online by that point, my name is Frank Curriero, so I direct the Spatial Science for Public Health Center here at the school. And what I want to do here, just to kind of transition us over to the virtual side of GISA, is just kind of give you a tour through some of the stuff we've been working on here over the last couple of years. So people that have taken our classes or heard me talk before, we take what we consider this comprehensive spatial science paradigm to a lot of the research we do here at the school, and it has three components: spatial data, GIS, and spatial statistics. And just to fill these out, this is simply spatial data, obviously data with location information. That location, how that comes in can vary a lot. GIS, well, that's your software for mapping and integrating all these data sets together. And then we look to the field of spatial statistics to kind of say, go beyond the map. Can we analyze that map and those trends? That's the box I live in. And Dick, when we were talking about, having the team, so we have teams of players that work in this space, and then some teams of players that work in the last box. So the last box is where I live. So the reason why we have this paradigm, so this has kind of evolved over the last 20 plus years for us, is that, the rationale is that, pretty much everything we do, everything we study here at the school, the health outcomes, the environmental determinants, no matter what we're measuring, all that likely varies spatially. So the idea is to collect and harness that information to improve everything we do. Study design, analysis, prevention, intervention, control, policy efforts, ... Right? So there's a lot more to that for sure. Sort of the team we have, so the top row, myself, Tim Shields, Michael Desjardins, Kara Weichgram, and then Jamie Harding. These are the permanent folks, permanent job folks. And then the bottom line is just a sample of some of our current students and trainees that revolve through the center and so forth. So this is that team we spoke about, and the team has varying expertise across that paradigm: spatial data, GIS, and spatial statistics. So what I want to do now is kind of just give you a feel through some of the projects we've been working on the last couple of years. Some of our projects fit into bigger categories, right? So I'll kind of go over those first. Lyme and tick-borne disease. This was something we started just back in 2020. Kara took the lead on this project, and we have a dashboard, the Johns Hopkins Lyme and tick-borne disease dashboard that's out there. One of the recent projects that we just finished was this idea of identifying the geographic leading edge of Lyme disease in the US using Google searches. And here is just a set of bivariate choropleth maps showing you the simultaneous correlation between Google searches and incidence of Lyme disease over time. We just took blocks of time here, and we modeled this and found that Lyme disease searches for the quote Lyme disease was significantly associated with the CDC reported incidence of Lyme, and about a 10% increase in the relative risk for Lyme disease for every, I think it's 100 unit increase in search for that term Lyme disease. Environmental influences on childhood health outcomes, ECHO. This is a school-wide project. It's led by the Department of Epidemiology. We have a set of us that are involved in the ECHO project. We're sort of just there as the spatial support team. When the project first started, we had a lot of webinars and trainings to kind of promote this idea of spatial analysis, not just using the map, although I'll always say the map is a great hook for people, so we show them the map, this is what you can do, and now this is what you can also do to go beyond the map. So we had a lot of that initial training. So the ECHO has cohorts across the whole country. And here's just an example set of supporting maps for different projects. So a lot of different projects going on this. So lead exposure, green space, PFAS, things like that. So that's the ECHO project. Cancer is always a big project that we're involved in. You see some of the projects up here, spatial disparities in clinical trials. Michael's getting involved with not just the School of Public Health cancer folks, but the Johns Hopkins Sidney Kimmel Comprehensive Cancer Center. We developed a dashboard that the Sidney Kimmel people use. A project here identifying and explaining breast cancer risk hotspots in Delaware. So this is with an external partner we have out of Christiana Care Hospital in northern Delaware. So Delaware, if you're familiar, it's just a stack of 3 counties. And this is the northernmost county. So you have New Jersey and Philadelphia to the north there. And what was nice about this data set is we had point level information on cancer cases over a period of time. And we can run hotspot detection or cluster detection. And we look at different things like screening rates, people, the hotspots of people that don't have screening, advanced cancer, triple negative, that's TNBC, triple negative breast cancer, and then also I think it was advanced and less than 50 hotspots. So we can look at all these different hotspots, put them on the map, and then the idea is can we go and explain these hotspots? And one of the things we looked at with these hotspots is looking at, well, what's the worst possible scenario for each of these hotspots, right? So the lighter yellow is the whole catchment area, the whole county, and then the orange and the red are the I think it's the Wilmington and the Middletown hotspots. Wilmington is the one up north, and just showing you that with respect to tumor histology, grade, triple negative screening, things like that, it's always a lot higher in these hotspots than it is in the full catchment area. And that information wasn't used in identifying these hotspots. It was just the incidence of those types of cancer. So cognitive health study. So this is the cardiovascular health study, CHS. This is work with Michelle Carlson over at Mental Health. And this has been an ongoing project where several of us on the team were involved. One of the projects here is about blue spaces and the incidence of dementia. And again, there were a few cohorts across the city, across the country. This is the Pittsburgh cohort, and it's just showing you sort of the overlap of blue space or water density and railroads, and that's on the bottom here. And the paper, which just actually got published, showed that there was a correlation between blue space, railroad density, and lower SES. So it kind of led to this idea of long-term environmental exposures. And then when we kind of linked that to incidence of dementia, we were showing that you're at higher risk for mixed and or vascular dementia incidence in this cohort. And that's kind of opposite of what we think of with blue space, right? Blue space water, we think it's positive, just like with green space. But the take-home message here is that context really matters. Here we're in the Three Rivers area of Pittsburgh. So when you have blue space or mainly those rivers and other blue spaces, that it correlates with other things that aren't necessarily promoting health. We have the ISOMER, the International Center of Excellence for Malaria Research. This project's been going on for 10 plus years, and we had a strong spatial team involved in there doing predict risk maps for malaria. This is all done in Southern Africa, the Zambia region. Temporal and spatial analysis of different types of genomics for the malaria disease. We have a dashboard for malaria in compliance with the elimination strategy. So this is the dashboard here, and it's just kind of tracking daily cases of malaria in the area, making sure that they're staying within the elimination strategies. This next area, violence and drugs. This is a new area. Michael's kind of getting involved in this area. He has actually a K award on spatial science approaches to enhance gun violence surveillance and related determinants. He has a colleague out in Milwaukee where they're doing some drug violence analysis. This is just taken from one of his studies. This is the DC area, where it's showing along the top is the number and the bottom panel is the percent. And these are of gun violence exceedances in the top 75 and 90 percentile. So it's showing areas that are consistently problematic in terms of gun violence. He modeled this, and the modeled results are consistent with the map you're seeing here. Food system. So we have Jamie Harding from CLF, who is part of our overall team here at the school. They're doing a lot of GIS in terms of food systems, and they've been doing this sort of forever. And a few things here. This is the now I'm gonna have to put my glasses on for this one. Sorry. So this is the Maryland food system map. Again, I think it's been around forever, and they maintain this. We're also looking at agriculture, and livestock. So they got here is the map of hogs per county, and whether it's poultry, hogs, cattle, these are all play into our food systems, and the farming of those, the agriculture of those, can certainly lead to certain health determinants that we have to pay attention to. And there was another one here, which Jamie, that was really interesting to see when you sent this over. So this is a map, actually mapping federal food system grants dashboard. So it's mapping where people are getting research. And that's an interesting take. We had something similar idea that we're initiating with Lyme disease. Is we're not looking at where grants are, we're looking at where scientists are doing their work, right? So people may have a site up in Boston, people may have a site up in Pennsylvania, Tennessee, and so forth, and we're going to map all that and kind of see, does that correlate with the incidence of Lyme? Are people researching where they should be researching, and are there gaps in that research? And I'm sure this is something similar that you were doing with this dashboard. So that was really interesting to see. And then a lot more other food system related GIS work that's being done at the Center for Livable Future. Here is just a list of miscellaneous projects. I can call them one-off projects, so that kind of makes it really, it probably doesn't do it justice, because sometimes these things take a year or a year plus, but they don't fit into a bigger category. So you can just kind of scroll down and see the list of those. This top one is something where you are collaborating with Jamie and his group over at the Center for Livable Future, mapping analysis of dairy CAFOs and methane digesters in California. So we developed this dashboard showing you in California where all the dairy CAFOs, these are confined animal feeding operations, right? Okay. Where they're located, and the idea is the fact, so historically we used to have lagoons where where the CAFOs would dump all the manure and the waste, whether it's chickens, hogs, in this case, cows, and the transportation of that, removal of that waste caused a lot of health problems, health concerns, and so forth. The digesters now is they're looking to cap that, okay, physically cap it and capture the methane gas and pipe that out. And then obviously that's a source of revenue for the CAFOs. The concern here is that might start this idea of like a cluster of digesters. If one place has one, then another farm close by might want to get a digester too and link into that pipeline and so forth. And that could be a problem in itself. So I don't want to get in too much detail with this one, because Karen and Jamie are going to have a lightning talk in the 4 o'clock hour on that. So those are our miscellaneous projects. Some takeaway messages, so spatial analysis can be seen as an added benefit. It always has been an added benefit. You want that map. Somebody, can you put a map? It'll be great. Look at a map in a paper, but it's gone a lot more than that. Okay, so it's an added benefit plus a lot more now that we do with spatial analysis. Spatial analysis continues to be applied across the spectrum of public health. That will always be true. Dashboards are great tools for communicating and presenting spatial analysis. Dashboards became popular with COVID, obviously with our famous JHU COVID dashboard. Dashboards have been around before COVID, okay, but they just were popularized because of COVID. And we're finding out not only is it a great end product to have to give somebody and say, here, we can put this out, outward facing product of your work. We're also developing these, like we did with this CAFO project in California, developing these more as an internal dashboard to communicate to our partners, the people that are working on this, because not everybody's a spatial analyst. And it's a great tool because, as you know, maps are a great resource for generating and refining hypotheses. So it's great to have that in our monthly meetings, the dashboard. What else did we add to the dashboard? Let's look at this. And it's really becoming a popular tool for us here at the school. Over the last 2 years, I counted, we have over 50 plus publications from our team here working on spatial analysis. And half of those, we are taking the first or the senior author on that, which really comes back and talks more about it's an added benefit plus, because it's not just we're throwing a map in there. We're actually, the objectives of these papers are based on spatial analysis, spatial variation, and modeling the spatial variation and all those kind of things. So it really is, the paper is more a spatial paper rather than, an XYZ paper with a map, something like that. So I'm really proud of the team getting to this point. How do we get here? It's not just one or two of us show up here and know how to do this. It's really through education, and for the last, when I first arrived at the school, I'm gonna have to go back a little bit, but I think around 1998, Tim and I developed a course, and then that course went to 2 courses. Now we're at 4 courses. Okay, so the first 2 terms 1 and 2, that's your spatial data and your GIS. Terms 3 and 4, that's your spatial statistics. So we're training students to do this stuff. So they take it into their PhD research. They take it with them moving to another academic institution or to industry and so forth. So this is really the driver behind our ability to continue to do that stuff. The slide I showed with the pictures at the top, a lot of those people at the top took the courses, and all the trainees and the students at the bottom obviously are taking those courses as well. I think it was in 1998, we developed this online master's and certificate program in spatial analysis, so we can reach those not here at the school to work on this. And a lot of the content in these courses come from these courses here. So, this is an important piece in a lot of what we do. That is all I got. So happy to take any questions. Do we have students in here now that are in any one of these classes?
Yeah, first series.
You took the first?
Last term, or JS.
Okay, you take any more? Okay, we'll sign you up for it. Don't worry. These are popular classes. I mean, that first class is usually 100 plus students. It dwindles down. Obviously, when we get to spatial statistics, I think we have about 50 or 60. And then for this last one, I think we end up with about 25 or 30. So it's an exciting series, but
Is the first one on?
no, it's just once a year. Yeah, but it's also offered online, so it's remote. All these classes have a remote option as well, especially since COVID.
Oh, but only once a year.
Only once a year, right?
Yeah, how do these interface with, like, is there a program on Homewood campus that also would deliver our GIS classes?
There is an advanced programming class, a continuing ed type situation, similar to what we have with our online program here. I am sure there are GIS classes, maybe here and there in different departments.
Oh, okay. But department like this.
Yes, yeah, it's yeah, Earth and planetary science,
Yeah.
but it's embedded within another course. I don't think there's a specific there may be a specific GIS class.
Yeah, GIS for anthropologists.
Yeah, something like that, yeah.
For their-
Yeah, and ours is for public health, right? So obviously we're focusing on public applications, but you know, GIS and even spatial statistics to that matter, you know, everything to us, the outcome is secondary.
Yeah.
It's the method. So you learn the software, whether you apply it to, earth and mineral sciences or you apply it to public health, and the same thing with spatial statistics.
Yeah,
So,
I've done the exact thing, like the same method,
yeah,
completely different topics.
Yeah. which is nice as a professor because, well, it's nice and it's a double-edged sword. It's like I get to see all these different outcomes and see the, spreading the faith of spatial analysis across the spectrum. But you don't become an expert in anything except for the methods, right? You work a lot in cancer, you work a lot in this, but you're not. I would never call myself a cancer epidemiologist. So,
I think we're too hard on ourselves too.
yeah,
Maybe.
yeah. After a while, you get to talk.
Yeah.
Other questions? Okay, well, thank you for joining this